Dr. Craig and Dr. Peter sort of give a background on their expertise and why we brought them to this call, because I think I'll butcher more of their background and translating it into layman's terms than the other way around. So if you don't mind, Dr. Craig, we'll let you go first.
Okay, thank you so much, Adam. Well, let's see. I am a physician, board certified initially in emergency medicine, and then worked for many years in vascular medicine, also in preventative medicine, and particularly in clinical informatics. And for a number of years, I've been chief scientist with WhisperSom Corporation, which is developing less invasive ways of managing sleep apnea, ways that might be effective for people who cannot tolerate CPAP or for whom CPAP is not the best option or not a good option. And I also spent many years as head of the Institutes for Innovation in Washington, D.C. We had quite a large group of people working on innovation in every area of medicine, from nursing to critical care to outpatient to pre-patient, pre-hospital, and emergency. Part of that system, we had a large project, multi-year project, federally funded, to develop new hospital designs that would be all risks ready, that would scale up 10-fold or 20-fold in the event of a disaster, precisely like the disaster we're facing now. We worked extensively in bioterrorism, and bioterrorism is something that occurs very rarely, we hope never. And as a result, and we've had only a few incidents of bioterrorism in the world since we started working in this more than 20 years ago. But the model that occurs every year that behaves just like bioterrorism is emerging disease. Because every year we have these diseases emerging, mostly in the area of Wuhan and a few other hotspots. And then most years they piddle out on their own, they get shut down, they're well contained, you get a small cluster of cases. Every so often we end up with effective human-to-human transmission, and it takes more public health effort to control it. We've seen those, but most people are aware of those larger events. And then, of course, our greatest fear is that one of these will escape and be the mixture of transmissivity and lethality that creates the kind of perfect storm we're seeing now. Of course, the one we're seeing now isn't as bad as it could get, but it is absolutely bad enough. And so I'm happy to be able to help in any way I can and bring any of the perspective that I have to this conversation.
Well, thank you so much, because I'm sure everybody on this call already just learned more in 5 minutes than we probably learned in the last 3 weeks.